Oman Vision 2040, Landmark Group is committed to continually elevating the community's health and well-being. Therefore, we are truly delighted that with our customers, we are able to help less fortunate families during the holy month of Ramadan. Rahima Al-Musafir, Chairman of Board of Directors of Al-Rahma Association for Motherhood and Childhood, said the following. We applaud Landmark Group for partnering with us once again to fulfill our mandate of supporting vulnerable communities. Year after year, the association has constantly worked hard in finding ways of improving the living conditions of hundreds of families and orphans in the Sultanate. Today, we are pleased to rejoin hands with the leading retailer that not only share our values, however, have unceasingly striven to give back to the communities in Oman. The Landmark Group has partnered with humanitarian organizations across the region to roll out GCC-wide fundraising initiatives as part of the group's CSR objective to support the least privileged segments of our society. Speaking on the rollout of the group's GCC-wide Ramadan campaigns, Nisha Jagtiani, Group Director, Landmark Group, said the following. By supporting Al-Rahma Association, we aim to raise awareness and funds for the critical humanitarian work they do in response to crisis and supporting vulnerable families. Through such collaborations, we can drive the importance of our collective responsibility to support communities in need. Together this Ramadan, we can help families whose lives were devastated by circumstances out of their control to continue building a safer future. There has been a significant increase in new cases of coronavirus infections and deaths in the time between March and April 2021, a social activist and data analyst has found after analyzing Ministry of Health data. Speaking exclusively to the Times of Oman, Ibrahim Al-Maimani said the following. There has been an increase of 97% in new infections between March and April 2021. The number of new cases in March reached 17,722 and in April it reached 34,886. He cited the data to point out that July 2020 was the highest in terms of new infections, which had reached 39,000 then. The rate of recovery rose by 164% as 11,507 recoveries were recorded in March 2021 against 30,394 recoveries in April 2021. In terms of hospitalized cases, Al-Maimani confirmed that it was noticed that the number of hospitalized patients at the end of March was 515 and by the end of April there were 821 cases, an increase of 59%. He also said, as for intensive care cases, their numbers reached 156 cases at the end of March and further rose to 276 at the end of April, an increase of 77%. When analyzing the death index, which is the most important indicator, we notice a large increase in deaths as the total deaths in March 2021 reached 108 and further to 343 in April 2021 with a rate of 11.5% deaths per day. Movement ban in Oman will become effective between 7 p.m. and 4 a.m. on Saturday, May 8th until May 15th, according to the Supreme Committee tasked with tackling developments resulting from the coronavirus pandemic. In a meeting held yesterday under the chairmanship of Syed Hamoud Faisal Al-Busaidi, Minister of Interior, the members followed up the pandemic's developments, procedures to prevent its spread and discussed ways to tackle its impacts. The committee discussed the situation in light of the latest data on the virus and its variants, as well as statistics about patients infected with the disease, deaths and those admitted to hospital wards and intensive care units at different hospitals in the Sultanate. The Supreme Committee urged private sector establishments and companies to implement or continue to implement online work and downsize the number of employees needed to attend at the workplace. It also stressed that adhering to all precautionary measures, most importantly avoiding gatherings during the remainder of the holy month of Ramadan and during Eid al-Fitr holidays, is capable of securing the safety of an individual, the family and the whole society against these dangers. It also affirmed that it will be on constant convening and that it will continue to revise its decisions in accordance with the developments of the epidemiological situation. The major decisions of the committee were the following. Ban to continue all commercial activities and to prohibit the movement of people and vehicles with effect from 9 p.m. to 4 a.m. from Saturday 8th May 2021 in all governorates of the Sultanate as per the earlier decision. The movement of people and vehicles to be banned from 7 p.m. till 4 a.m. with effect from Saturday 8th May 2021 to Saturday 15th May 2021 with the exception of segments announced earlier. All commercial activities to be banned throughout the day with effect from Saturday 8th May 2021 to the end of Saturday 15th May 2021 with the exception of foodstuff sale outlets, fuel filling stations, health establishments and pharmacies. Home delivery service to be allowed for all types of goods during the ban period. Attendance of all employees at the workplace to be suspended and substituted with online work for all units of the state's administrative apparatus and other public legal entities with effect from Sunday 9th May 2021 to Tuesday 11th May 2021. No Eid prayers, no pre-Eid souks, no gatherings or assembling of any kind is allowed in all places, including beaches and parks during Eid al-Fitr holidays. This also includes a ban on family gatherings or Eid gatherings or mass celebrations of the Eid. The Government Communications Centre has published a clarification on the decision to ban commercial activities and prevent the movement of individuals and vehicles in Dhofar Governorate. A statement issued online by the GC said the following. The implementation of the decision of the Supreme Committee in charge to deal with COVID-19, which has been issued on Sunday, will include banning all commercial activities and preventing movement of individuals and vehicles from 9 p.m. to 4 a.m. in Dhofar Governorate from Monday, May 3rd, 2021 until the morning of Saturday, May 8th, 2021. Those are all the local stories today. We'll now take a short commercial break and we'll be back with our special segment, Fighting COVID. Welcome to Fighting COVID. A year ago, when the COVID-19 pandemic was still in its relative infancy, the head of the World Health Organization stressed on the fact that a global approach would be the only way out of the crisis. The way forward is solidarity. Solidarity at the national level and solidarity at the global level. WHO Director General Tedros Adhanom Ghebreyesus told a media briefing in April 2020. Fast forward 12 months and the devastating scenes in India, where hospitals have been overwhelmed by a surge of COVID-19 cases and thousands are dying for lack of oxygen, suggests that warnings went unheeded. Now, the status across the globe. India is not the only global COVID-19 hotspot. Turkey entered its first national lockdown on Thursday, an unwelcome step prompted by infection rates which are now the highest in Europe. Iran reported its highest daily COVID-19 death toll so far on Monday, with many towns and cities forced into partial lockdown to curb the spread of the virus. Iranian President Hassan Rouhani has said the country is suffering a fourth wave of infections. The picture across much of South America is also gloomy. Brazil, with more than 14.5 million confirmed coronavirus cases and nearly 400,000 deaths, according to Johns Hopkins University, continue to have the highest daily rate of COVID-19 deaths per million in the world. Some countries have offered help as hotspots emerge, for example, flying in oxygen concentrators, ventilators and other medical supplies to India in recent days. But the coordinated global response urged by Tedros a year ago and repeatedly since by WHO and other global health bodies remains elusive. And while some Western countries are eyeing a return to more normal life in the coming days, the worldwide picture remains dire. The number of global COVID-19 cases has risen for the 9th consecutive week and the number of deaths is up for 6 weeks straight, WHO said last Monday. Now, talking about COVAX. COVAX, the global vaccine sharing initiative that provides discounted or free doses for lower income countries, is still the best chance most have of procuring the vaccine doses that might bring the pandemic under control. But it is heavily reliant on India's capacity through its Serum Institute of India to produce doses of the AstraZeneca vaccine, which are the cornerstone of the COVAX initiative. While India promised to supply 200 million COVAX doses with options for up to 900 million more to be distributed to 92 low and middle income countries, its own rapidly worsening situation has prompted New Delhi to shift focus from the initiative to prioritizing its own citizens. There has also been claims of a shocking imbalance where at the same time Western countries have been criticized for vaccine stockpiling. Some, including the United States, Canada and United Kingdom, have ordered far more vaccine doses than they actually need. UK Health Secretary Matt Hancock said on Wednesday that the UK, which is now vaccinating healthy people in their 40s, have already offered at least one dose to all its older and more vulnerable residents, had no spare vaccines to send to India. The UK government has said it will share surplus doses at a later stage. In the United States, everyone aged 16 and older is now eligible for a COVID-19 vaccine, and 30% of the population is fully vaccinated, according to data from the US Center for Disease Control and Prevention. Earlier this week, the White House said it would donate up to 60 million doses of the AstraZeneca vaccine, of which it has a stockpile but has not yet authorized in the coming months following a federal safety review. Well over half of Israel's total population has received at least one dose of the coronavirus vaccine, and the country is easing restrictions. As of early April, just 0.2% of the over 700 million vaccine doses administered globally were given in low-income countries, while high-income and upper-middle-income nations accounted for more than 87% of the doses, according to Tedros. In low-income countries, only 1 in more than 500 people have received a COVID-19 vaccine, compared with almost 1 in 4 people in high-income countries, a contrast Tedros described as a shocking imbalance. Meanwhile, many wealthier nations have pledged funds. They have been less ready to give up their COVID-19 shots. France last week became the first country to donate AstraZeneca doses from its domestic supply to COVAX. Now, talking about the situation in India, a second wave of COVID-19 is overwhelming India right now, and here's what we've got to share with you. India is being overwhelmed by a record-breaking wave of COVID-19 cases, with deaths keeping some crematoriums running 24 hours a day and hospitals running out of oxygen. The country has become the first in the world to report more than 400,000 daily cases, according to data from Johns Hopkins University, as the surge threatens global efforts to tamp down the pandemic and return to pre-COVID life. So, how many COVID cases does India actually have, and how many vaccines? India has surpassed 19 million cases of COVID-19 with more than 200,000 deaths, according to data from Johns Hopkins University. But the pace of both new cases and deaths is accelerating. The country set another daily global case record on Saturday with more than 400,000 new cases. According to official totals, experts suspect are undercounts. Less than 2% of the country is fully vaccinated, as well as with just under 150 million doses administered for a population of more than 1.3 billion people. So why is India having a second wave? New COVID-19 cases reached an all-time low in India as recently as February, prompting people to resume attending sports, religious and other social events. Prime Minister Narendra Modi, for example, held massive political rallies with crowds of tens of thousands of people. Modi has also faced accusations that he's tried to downplay the pandemic, with the government ordering Twitter to remove posts critical of the government's response to the virus. Environmental factors played a role as well. Lower humidity in some parts of the country, such as New Delhi, potentially helped the virus spread faster. And in some other parts of the world, the rise of new variant has complicated efforts to fight the disease. Now, what do we know about the new COVID-19 variant in India? The new COVID variant in India is called the B.1.617, and it's distinguished by having not one but two mutations on the virus spike. Scientists are still studying how the so-called double mutant might differ in terms of transmissibility and respond to vaccinations. But another variant, B.1.1.7, is also spreading in India. That variant, first identified in the United Kingdom, is highly infectious. B.1.1.7 is now the dominant strain in the United States. There's another point that we will be stressing on the show today, and that is why so many people are skipping their second shot of COVID vaccine and why they shouldn't be doing that. When the US Center for Disease Control and Prevention recently reported that almost 8% of the millions who have received the first dose of a COVID-19 vaccine hadn't returned to get the second shot they needed, it raised concerns that the country might not be able to reach herd immunity. But health experts say that what's more surprising is how low that number is, and that it points to the need to inform people about the importance of that second shot for their own protection and that of others in a pandemic, and to let them know that it's not too late to get it done. Two of the vaccines in use in the United States, the Pfizer and the BioNTech and Moderna vaccines, require that people get a second dose to get the maximum protection the vaccines can provide. It's not unusual for people to forego a required second shot of a vaccine, health experts say. The skip rate for the second shot for the vaccine that prevents shingles, for example, was about 26% among Medicare beneficiaries, according to a Kaiser Family Foundation analysis. The CDC said the number of people missing doses, 5 million, may not exactly be the exact count. If a person got the two doses from different reporting entities, for example, first from a state-run clinic and then from a local health clinic, the two doses may not have been linked by databases, a CDC spokeswoman pointed out. Now, the reasons and excuses people are giving for skipping the second dose. Several people have reported that they got their second shot at a different place than their first, and administrators at the first site contacted them repeatedly about making an appointment for a second shot, which had already been administered elsewhere. But some people are certainly missing their second dose. Fear of the side effects of the second dose, which are reportedly more severe than after the first dose for some people, along with trouble getting an appointment and finding the time for it, are among the reasons people have been giving for missing the second dose of the vaccine. The second shot for the Pfizer vaccine is supposed to be administered 21 days after the first. For the Moderna, the second dose is 28 days later. Making it easier to get the second shot could be one fix. Within the St. Luke's University Hospital network in Pennsylvania, for example, the success rate in getting people fully vaccinated is at 99%, said Dr. Jeffrey Jari, an infectious disease expert there, in part because the network made it easy to get the second appointment, assigning it when the first shot was given. The network then followed up with multiple reminders of the appointment 5 days out, 3 days out, and then 1 day before, and those who were unable to keep the appointment were given an easy method of changing it. More than 43% of the US population has had at least one shot of a vaccine, and 30% are fully vaccinated according to CDC data. And in many places around the country, it's getting easier all the time to get vaccinated as supply increases and demand slackens. Now, the harder fix is countering misconceptions. Another reason people may be skipping the second dose is not understanding the importance of it or being misinformed, and that may be harder to fix. Some people skip the second shot because they think the first one offers them sufficient protection. In fact, most Americans may be misinformed about the timing of immunity after vaccination. Results from a survey of 1,027 US adults taken between February 11th and 15th through a panel created by the National Opinion Research Center was analyzed. About 20% of those surveyed believed the vaccine gave recipients strong protection after the first dose, and another 36% were sort of unsure. Just 44% of vaccinated people reported that the vaccines conferred strong protection 1 to 2 weeks after the second dose, as the CDC guidelines stated. So what do we take back from this? That one shot is not enough. In fact, the first dose just primes the immune system, and the second shot sort of boosts it. This makes it a better option for obtaining immunity, according to a medical correspondent. While there is some protection after the first shot, it is not clear how long that lasts, and it is nowhere near what full immunization can offer. And then there's a question of whether the country can obtain herd immunity, meaning 70% to 85% of the population is immune, if the number of people who don't get a second vaccine dose keeps rising. According to the CDC, if it's not feasible to adhere to the recommended interval and a delay in vaccination is unavoidable, the second dose of both the Pfizer-BioNTech and Moderna vaccines may be administered up to 6 weeks or 42 days after the first dose. Well, that brings us to the end of our episode today of Fighting COVID, where we gave you the updates about the situation in India and America and across the world. We'll be back with Midday Update tomorrow, so stay tuned.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.